Hi, you guys. Welcome back for another day of our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review books, review courses, review videos, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to assist you as well if needed. But y'all know I always get into my disclaimer and reminders before starting with our questions, right? So there's no absolutes in medicine. We treat on a patient by patient basis, right? So any of the questions that you see here, I have designed and created based on the current guidelines that are currently being tested on the ANCC as well as AAMP exam. Now, any of my videos, if I am teaching on things that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing first line therapy for diabetes. Which medication is first line therapy for diabetes? Is it A, Levemir, B, Lantus, C, metformin, or D, glipizide? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first so it allows you to slow down and ensure that you are answering what is even being asked. So here the stem of the question states, which medication is the first line therapy for diabetes? All right, so the stem explains everything, right? So what is first line therapy for diabetes? Now we can look back to make sure there's not any other context that we need to include or consider in the scenario, but it just simply says that a nurse practitioner and NP student are discussing first line therapy for diabetes. So this is a knowledge based question. When you have that initial diagnosis of diabetes, you should instantly think metformin is that first line therapy. For board's purposes, you need to know. Now, I know, again, we do things patient by patient basis, but for board purposes, make sure you know that metformin is that first line therapy, okay? All right, question number two. The patient was started on metformin and is complaining of frequent diarrhea. What is the best response by the nurse practitioner? Is it A, continue the medication? This is common when starting metformin. If this lasts over 2 to 3 weeks, return to the office. Is it B, stop the medication? C, continue the medication. This is common. If this exceeds over 5 days, return to the office. Or D, change the medication dose. Take a moment and tell me what you got in the comments, you guys. All right, so here, stem of the question states, what is the best response by the nurse practitioner? All right, so what are we responding to? So the patient was started on metformin and is complaining of frequent diarrhea. All right, so as we work through these answer choices, what should be going through your mind when you think about metformin, right? One thing we know about metformin, GI complications, GI issue, diarrhea is classic, right? So you can instantly say, we're not going to stop the medication and eliminate B, right? So A, continue the medication. This is common when starting metformin. If this lasts over 2 to 3 weeks, return to the office. Okay, that sounds about right, but we'll hold it, right? We said we're eliminating B. C says continue the medication. This is common. If this exceeds over 5 days, return to the office. Uh, and so if you get kind of stuck and not really sure, that's where the knowledge kicks in, right? One versus the other. But we do continue the medication because we know this is a common side effect when initiating metformin. But it is also known that once continuing, it typically resolves. The GI tract is trying to get accustomed to this medication. It says that it is believed to like affect the what's the word I want to use? For lack of better terms at the moment, but basically like to it disturbs that environment, like that the balance, the normal like structure and micro levels of that area, if that makes sense. It's I don't know why I'm drawing a blank on that word right now, but you know what I mean. We're typically in this standard. We put this medication in, it starts to try to adapt, and it's disturbing the environment, causing diarrhea. But after the body gets used to it, it resolves. So you want them to continue it. It typically has never shown to exceed over a month, but guidelines tell you 2 to 3 weeks is what we typically tell patients. Continue it for this duration, and then we'll revisit it if this has not resolved. Okay. So A is your best answer choice. And y'all know when I think of that term, so when I randomly bring that back up, just know it came back to me, y'all. All right, question number 3. The nurse practitioner is explaining to the NP student contraindications for metformin. All of the following are contraindications of metformin, except is it A, renal insufficiency, B, heart failure, C, asthma, or D, hepatic insufficiency? Take a moment and tell me what you got in the comments, you guys. Tell me what you got. Tell me what you got. All right, so stem of the question states all of the following are contraindications of metformin, except. So again, this is a good reason why we like to look at that stem of the question to slow you down and pay attention, because it says except. It's one of those absolutes. It's one of those terms that you need to, pay attention to so that you're not tripping up over these answer choices, right? Because you don't want to pick the correct one. We're looking for the incorrect answer at this standpoint. So knowing the contraindications, but which one is not a contraindication of metformin? Is it A, renal insufficiency? No, that's correct. That is a contraindication for metformin. B, heart failure. B is correct. Heart failure is a contraindication of metformin. C, asthma. C is the answer. Asthma is not a contraindication for metformin. And D, hepatic, excuse me, insufficiency is a contraindication as well of metformin. So just make sure you know those things. As you can see, I'm trying to implement more of these things to make you walk through the full picture of different diagnoses and medications, but also kind of throwing things out to kind of keep these things in your mind or put them on your mind so you know and are prepared for boards as well as practice. Okay. All right, you guys, as always, I hope you found this helpful. But make sure you like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. If you need any other resources that I offer, I have an ebook and paperback option of my review book. They're both linked in the bio of this channel. It is broken down by system, and each system has an interactive section that tests you in the same format that I speak of: assessment, diagnosis, evaluation, and treatment. There is a quick medication and lab resource, as well as practice questions at the end with rationales. This is designed for family and adult gero. My adult people just exclude the ped section. Also, there's a self-paced review course that I offer. It's all online. You do it independently. You can utilize it on any of your devices. It's also broken down by system, images, all the things are tied together. You see videos of me teaching through all of this for family, adult gero, for the preparation of AMCC as well as AAMP exam. There is a non-clinical section also included into this, and you can watch it as many times, but this is also linked in the bio of this channel. And then 5-week review course, y'all who have enrolled for the next one starting on Monday, y'all should now have emails. Everything has been released to everybody that registered and enrolled, so you have access. You'll see that you're able to see the syllabus and the resources included. And then on Sunday, everything will open for week 1 for you to see. Okay. And then lastly, if you're looking to enroll with one-on-one sessions, I offer sessions for weaknesses. So if there's just one particular thing you want to work on, that's an option. If you are just wanting to assess your exam readiness, that's an option. And then the third option is the custom package, where it's strictly designed for what you need. So say you've been unsuccessful on boards before, you just don't know what to do next. We work together, gauge where your weaknesses are, restructure your studies, and work alongside with you to prepare you to be successful on boards. Okay. So if you need any of those resources, feel free to reach out to the Nursing Studio at 803-400-6864, or you can shoot a text to that number as well, or shoot us an email at thenursingstudio1@gmail.com. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.